Item 3 is public comment period. It's for anyone to have 3 minutes on the topic not officially listed on today's agenda. Are there any public comments? Okay, I see one online, none in. Are you controlling that, Sunday? No, you can't. You gotta. Ben, I see your hand up. Please go. You got 3 minutes. He's unmuted. Ben?
Ben, can you hear us? Go ahead.
Ben? We still can't hear you. Oh boy.
Try again. His mic, it says his mic's on.
Can you hear me okay?
Yes.
Sorry. Go ahead.
Oh, thank you. Good morning.
Good morning.
You got 3 minutes.
Well, thank you, Chris. I don't think I need 3 minutes to say what I think needs to be said in public and in front of this particular board, which is we all know, and we, of course, expected that Dr. Hughes would receive a ton of complaints, criticisms, and other kinds of threats, online, offline, emails, you name it. And so in her position, I just want to show our support from South Omaha in the actions she took to issue that mandate for masks. It takes a considerable amount of courage for any person, any individual, to stand up to this onslaught, even though it's not an immediate front door kind of threat. It is still stressful to be under that kind of an assault, verbal assaults, threatening assaults. So for myself, I just want to laud her efforts and the efforts of the county board, because this is the right thing to do at a critical time in our history. There are few occasions when, as a country, we have to step forward and be brave. Even under the shining light of criticism, we have to show our bravery because it's for the benefit of everyone. We know that. This is not any kind of an intellectual battle of any kind, because the battle has been won. It's won by science and it's won by medicine. That's how we prevail. So I just want to lend my support to Dr. Hughes and saying, bravo, Dr. Hughes, you did the right thing. Thank you.
Thank you. Any other comment? And I'm looking on the screen and I do not see any, so we'll move on then to item number 4, which is approval of action items. There's A, B, and C. D is removed. Is there a motion to approve items A, B, and C? Motion by Gray. Is there a second?
Second.
Second by Wade. Roll call.
Gray?
Yes.
Rogers?
Yes.
Wilson?
Yes.
King?
Yes.
White? Yes. Wade?
Yes.
And Espinoza?
They can't vote online. So, okay. With that, we'll move to item 5, which is the director's report and issues of discussion. Dr. Hughes.
Good morning.
Morning.
Hopefully these mics are working okay. All right. First of all, does anybody have any questions about the reports, the division reports? Great, okay. With that, then I will dive into our personnel report, and then we'll go on and talk about COVID after that. Over the past month, we had a resignation in the CHNS division, Community Health and Nutrition Services division. Our community health planner, Celeste Ehrenberg, I think I had mentioned that maybe at the last meeting that she was planning to leave, and she has resigned, and so that position is now open. One of the important things to note there is that she was the person who was really pushing and coordinating our accreditation efforts. So I wanted to quickly just give you an update on that since we're already talking about that. We are, of course, still planning to become accredited. We're still planning to work towards that. Right now, we've taken a short break in meeting just so that we can move forward in a thoughtful way, making sure that, you know, whoever we hire into this position is going to be someone who's experienced and has the ability to help us push those efforts forward. We also have some reorganization that we would like to do within our teams to make sure that it is much more of a department-wide effort and to just really ensure that we're setting ourselves up for success in this effort. It became apparent that we were missing a few large pieces, so it just made sense to step back for a little bit and kind of regroup before we move forward. But I wanted to assure the board that we are still making progress and moving forward with that. We had a few other staff changes this month. Alan Brown in food safety requested a transfer over to sanitation, which we did approve. So there's now a vacancy for an Environmental Health Services 1 position. Leah Castaneda accepted and began working as our Chief of Community Health and Nutrition Services. She has hit the ground running and has done just an outstanding job of keeping that work moving both in the interim once Carrie Kernan left and since taking on that position. She's really just dived in and taken that, really taken the bull by the horns there. So we're so grateful to have her. Unfortunately, that does leave us with a vacancy now with our STD program as the supervisor position is now open. So we will be interviewing and hiring for that hopefully soon. We do not have any pending offer letters at this time, but we also do have a few new hires that we would like to highlight. We had the pleasure of hiring our new health equity advisor. His name is Jamin Johnson, and I believe he is online today. We are so excited to have him. This means that our health equity office is completely staffed at this point, and we're just really excited to push that work forward. All three of them have already been integrating themselves into the community, meeting community partners, and really trying to get to know Omaha as well as possible so that they can be successful in their work. So we're just extremely grateful to have Jamin on board, and we know that he is going to help us do fantastic things with our health equity work. Benny Huerta Camarillo and Jordan Cedillo accepted and began working as community health workers in our health promotion section. They're supervised by Patty Falcone down in health promotion. Poonam Rai accepted and began working as a community health worker in the lead poisoning program. So we got that taken care of and that position filled up. So that will be very helpful under Supervisor Nadia McCracken. Brian Bostock accepted and began working in air quality as a specialist there under Russ Haddon. Lisa Steinbach accepted and will start this month as a clinical nutritionist in the WIC program. So I know that Cassandra Dietrich, our supervisor there, has been excited to get that filled. So we're very happy to have her on board. And Diana Ortiz accepted and will start this month as a community health educator, also down in health promotion with under Patty Falcone. So we have brought on a number of staff this month and gotten some of our important positions filled in, and I think that's going to be a really helpful thing both for the department and for the community. We are currently interviewing for our public health nursing tuberculosis program position. We have a couple of those, and we have one that we are filling, so we'll be very happy to have our capacity up to par there. We did repost a few different positions, so we have still 2 public health nursing positions open. One of those is for the Fetal Infant Mortality Review Program and also another TB nurse. We have 2 community health worker positions open, an environmental health specialist. Our clinic clerk position in the STD program has been open for a long time, so we are still looking for somebody who can fill that position for us. and of course that supervisor position in STD control. So we are hoping that we can do a better job of maybe outreaching to hire some of these positions and think creatively about how we can get people on board. And that, I believe, is it in terms of our personnel. I do want to go ahead and talk to you about COVID, though. Give me just a second. You'd think it would be the first thing that pops up as often as I do this in here. All right. So I want to make sure we get this shared. All right. So it's probably not a surprise to anyone that we continue to be in the high transmission category for COVID-19. We continue to see a number of cases that are coming in. Our 7-day total number per 100,000 has dropped slightly over the past few days, so that is heartening. I am hoping, beyond hope, that that comes down as quickly and precipitously as it rose. So hopefully we will continue just to see those cases decrease. So we're at 1,643.2 per 100,000 for that 7-day total. You can kind of see over on that right side where we spiked and then started to come down. This has only been for a couple days though, so we can't really call it a trend just yet, but we're going to definitely keep a really close eye on that. In terms of who is getting COVID right now, it's pretty much everybody. But here you can see a breakdown by age groups. A lot of you are familiar with this particular slide. If we keep honing in on these really colorful stacked bars, you'll see that the bar to the right is the most current as of 1/15. So you can see we've had growth in cases in just about every single age category, but the most significant growth has happened in the 20 to 29 and then the pediatric, so basically under 19 age groups. So we continue to see a lot of cases there. And we continue to, stress the importance of prevention for all of these age groups. We're continuing to encourage boosters for those who are eligible, masking, of course, and all of the other things that we know have been helpful so far. Actually, I want this one. In terms of test positivity, we see that that's starting to maybe level off a little bit, but again, I think it's too early to call this a trend. So you can see it's starting to kind of curve up at the top. We're still really high with our test positivity, sitting up at 29.3%. That is much, much higher than we like to see that. So we're going to hopefully start to see that come down as well. But given that a lot of people are testing, we may see that number up there for a while. On the testing subject, I wanted to also just point out, if you hadn't seen it yet, that as of I believe today, you're able to, every family in America is able to go online and order up to 4 free home tests that will be sent directly to their home. So we are very happy to have that to help alleviate some of the testing capacity issues. We hope that families will use those, to make sure that they're not sick or not contagious as they're going out and about, if they've had an exposure. I think we will still continue to see some demand here for local testing as well, but I think that that's going to be very helpful. Of course, I also wanted to point out to you, which I'm sure you already know, that those home tests are not reported to the health department. So if somebody has a positive home test, we don't necessarily know about that. So when you're looking at those case rates, just know that there are probably a number of positive home tests out there that we're just not capturing. So it's probably not quite as high as it might be if we were capturing those. We do continue to report deaths for COVID-19. We are up to 964 currently. The last report that I saw was sorry. The last report that I saw, none of the most recent batch that came in were vaccinated. And that continues to be something that we see, that most of our severe illness and deaths continue to be predominantly in the unvaccinated population. We have had a handful that have been vaccinated and also, had that severe illness or death. Typically, those cases are well over the age of 65 and or have some kind of an existing health issue. Actually, before we go there, let's talk about hospitalization. So we continue to see higher levels of hospitalizations, but happily, over the last couple days, our overall capacity has dropped a bit. So that is excellent news. It was 85% yesterday. We would like to see many days sustained at that or below. So very happy to see that. We do continue, however, to see a number of people who are admitted into the ICU and on ventilators. So definitely still out there, and it's important to keep in mind, too, that our hospitalizations typically lag our case rates by a week or two. So we may yet see some increased hospitalizations when you're looking at that, given that very, very large spike that we saw. Our breakthrough cases are up to 5.8%. This is not necessarily surprising for a couple of reasons. First of all, we know that most of the tests that we're sequencing right now are Omicron, and we know that our vaccines, especially without the booster, are not quite as effective as they were against Delta and previous variants. They still work pretty darn well at preventing those hospitalizations and deaths, but we know that we have more breakthrough cases with Omicron. I want to stress the importance of the booster with that, because the booster seems to do a much better job at preventing Omicron. So it's just really important to get that booster in. And then our rate of death for those who have been vaccinated and then have gone on to test positive for COVID is 0.023, which has not increased significantly. So that's telling us that, yes, we're having more breakthrough cases. However, most of those are likely in the mild to moderate and not necessarily severe category. So let's take a look quick at vaccinations. Right now we're sitting at 64.6% of all of our Douglas County residents being vaccinated. Of course, that includes those under 4 population that are not eligible yet. In terms of our eligible population, almost 70% have been vaccinated. So that's great news. We continue to make progress there. I know that our vaccine clinics continue to be busy, so hopefully that will continue until we get those rates up even higher. Looking at our adolescent population, 63.8% of that population is fully vaccinated. 70.6% have had at least 1 dose. So of course, the hope would be that the rest of those who've had 1 dose will come in and complete their series so that they're fully protected. For our most recently eligible population, the 5 to 11-year-olds, right now we're sitting at 26% fully vaccinated, so that leaves a lot of room for improvement. It also means that we still have, as you saw before, a fair amount of transmission that can still be happening in that age group. So we do continue to see that, but we'll continue to hold those vaccination clinics at schools and other accessible places to hopefully get that rate up just a little bit more. And as you all know, I did utilize my authority under the city code to enact a citywide, and I want to stress that's citywide, not county, but citywide, emergency mask order in place for 4 weeks and dependent on a couple of different metrics, both of which I've covered here. So one of them is this 7-day total number of cases per 100,000. So we want to see that come under 200. If it continues to drop as quickly as it went up, I think that that's pretty achievable. And then we also want to see our hospital capacity drop. Really, one of the big reasons for that mask order was to protect our waning capacity with our hospital systems. And so we were at 85%. So that is actually the benchmark that we're striving for. So we're going to keep our fingers crossed that we continue to see our hospitalizations drop and make sure that we have that capacity there. And as you know, we did have a hospital system last week that declared crisis standards. So quite serious. I don't know that people understand what crisis standards really mean, but it's essentially rationing healthcare and giving the care to those who are most going to reap benefit from it. So that can be a very, very difficult thing. I'm sure that was a very hard call for them to make. Unfortunately, when your capacity is stripped, that's about all you have left to do. So hopefully, as we are masking and doing some other prevention in the community, we can help them to preserve that capacity as well. We continue to also hear, that businesses struggle to keep staffing because people are calling out sick so much. One of our local school systems made the decision to throw in some remote learning days because they are having trouble keeping teachers because so many people are getting sick. So hopefully this is something that's going to help protect that and hopefully keep our kiddos in school more than remote, because we all agree that school is the best place for them to be. And with that, I think I am ready for any questions you might have.
I said you answered any questions about the initial question about the test, but I'm just curious, what's the conversation around about trying to keep track of that, or is it just some built-in degree of, example, like a political poll, you have a 5 to 4% margin of error. Are you all talking about anything of that degree to give a more realistic view of what's out there when these home tests are going?
Yeah, we have actually talked about that. I don't know that we've made any solid decisions on it yet, but I think that'll probably happen in the next week. We have talked about the possibility of standing up some kind of a survey or form that the public can access if they have a positive test. We know not everybody's going to report their positive tests, but we would like to, if possible, give people the option for that. The important thing for people who are testing at home to know is that if you have a positive test, you should stay home and ensure that the people that you've been around in the preceding couple of days, know that you have a positive test so that they can also watch for symptoms and protect themselves and protect their loved ones. So, we want to make sure that people understand the process. So, in conjunction with a possible form, I think ensuring that we have good education to follow that or to accompany that would be very important.
Okay. You mentioned the workforce piece.
Mm-hmm.
My just gut instinct thought that education may be next, and it kind of is playing in. Are there any indications you're getting from, I'm trying to think of some of the workforce areas that got hit hard early in April of 20. Are you hearing any indications like food processing, any of those things getting anything to some degree?
I haven't heard anything like that. My EPI staff can certainly unmute and chime in if they've heard anything different. I have not. I know that, one of the things that we are experiencing at the Department of Health is an increase in cases. So, we're trying to manage that. So I can imagine as careful as we are about prevention, that others certainly are seeing that too. I just haven't heard any specific reports.
Okay. Had you had any conversations or having any conversations with any of the other governmental agencies that are implementing mandates to kind of go with the workforce? Have you been in dialogue with them, or are they kind of operating through their own medical council?
I have spoken with Douglas County HR, so they did reach out for my recommendations there. And they, I believe, issued their new guidance early last week. And so that's out. Other governmental agencies here in Omaha, I've talked to the jail. They have certainly had quite a time of trying to control this most recent round. It just speaks to how incredibly transmissible Omicron is, because they had an incredibly good system set up for prevention, and they're still having some cases. So I've spoken with them. There have probably been others that have reached out that I'm just not thinking of right now, but I have spoken with several.
Okay. That's all I got. Dr. King?
I just have a question about the poll that was being done to either support or oppose the mask mandate. Is there a result or anything available of that poll that can be shared?
Yeah, let me clarify that, Dr. King. It wasn't a poll per se. It basically was to manage the amount of calls, because nobody could get the aides up front had to answer those calls. So it was just a way to vet to have to handle the calls. It wasn't a poll per se. So
Right.
just so everybody knows. Yep. It wasn't a poll. It was just a way to manage the inflow of calls.
Yeah, I don't
so
think
we
they're
wouldn't get caught
actually
up with
logging
stuff.
it
Yeah.
that I know of.
Yeah, it was just matter of fact, if somebody had they want to talk about that, it would direct them toward a path. And then it was like one option if you were for, one opposed, 2 against, 3 if you had other general county business that need to happen. So if you were coming for the response to the mandate, it just steered you a certain way and you went to voicemail and recorded it. It wasn't a poll per se, and we wouldn't keep it. It was just a way to manage the calls that were coming in, pro and con. Anybody else?
Yeah.
Do we have the capability, I know we were doing some home vaccination efforts. Is there a way to do like drop off rapid test for folks who might need that, kind of drop off at the door type thing?
Yes, we are actually doing that through our
Okay.
health equity grant. So we have a fairly limited number of tests to do that, but if we have people who can't get out to test for whatever reason, they have transportation issues or whatever the case may be, they can call our main line and request that, and we can drop off a test for them.
And also, are we promoting kind of the government's for free tests that just opened today widely on our county website?
I don't know if it's on the county website yet. I can check that really fast, but we will make sure that it gets a link to that gets added. I'm not seeing it yet.
I mean,
So
Dr. Jones, I do know I saw multiple emails from Andy, from staff, where they sent it out to those networks from the health department, and a couple of points social media where they were, but website-wise, yeah, it probably needs to get up there. But there was some effort started yesterday to put it out there to the advisory groups.
And it sounds like, and I just got a message from our clinic chief, and she said that they are actually having people at clinics help sign people up for that. So.
Okay, I see one question there. Ben, go ahead.
Yes. On the question of masks and test kits, what I read and what I understand is that the government is capable of producing large numbers of both in a very short period of time. And I'm wondering if they're able, the government, to supply private entities like Walgreens, for example, almost immediately with the test kits or the masks. Why isn't it possible for the health department to be able to grab a significant chunk of these test kits and these masks to be available to our community. For example, given the emergencies, the crises that we face, wouldn't it be feasible at all to immediately or as soon as possible open up, particularly in North and South Omaha, uh, temporary offices staffed with one or two folks to provide, to give out these masks and these test kits? Rent a space for 6 months, 3 months, and put a community health worker there, or maybe others that are capable of being there, and hand out these materials that are so essential to the health and safety of our communities. Uh, has that been examined or explored, Dr. Hughes?
It has. We actually have discussed the possibility of getting home tests that we can basically distribute to the public, through either a drive-through setup or kind of whatever would work. There are some logistical issues that we have to work through, but in terms of getting the tests, so we typically have to order, if we want a huge bulk order, we either need to order those ourselves. Sometimes that can be really difficult to find in the kinds of quantities that we would need to get. Or we, potentially would have previously gone through the state for that. And right now the state isn't offering that to the local health department. So we basically have to procure those on our own, which, it's kind of piecemeal sometimes, trying to find who's got enough tests to purchase and gather up. So we actually have discussed that and are trying to figure out logistically how we might be able to make that work.
Thank you.
So Dr. Hughes just reinforced that. So the state's not offering to go through them. So basically, the county health departments have to go straight to the Fed.
Correct.
Because the state's not, okay. All right. Go ahead, Dr.
Just kind of to add to what Mr. Ben said online, it may even be an option to partner with some of our current faith-based organizations and other sites that are already offering either vaccine clinics or doing things on the weekends to offer other types of services and resources to community, if that's an option, rather than, I know we're understaffed right now, to try to find a site and put some staff there to hand out these supplies when we could just leverage what's already happening.
Yeah.
So that's another option.
It's a good one.
But Dr. Hughes, let me ask, just make sure, are the take-home test kits on kind of the same ramp up as vaccines, for instance, until they got them really rolling, they had a certain amount, they had to kind of portion them out. Eventually, we'll get to the point where you think we'll have enough to have them pretty readily, like we did, like vaccines are right now. Is that what I'm hearing you say?
I would hope so. And you're correct. So
Okay.
typically we're filling as demand increases. So, it wasn't like we had 3 billion of these sitting in a warehouse somewhere just ready for people to start wanting them. I think that the companies really started trying to produce faster, in the last month or so. So that hope is certainly there. Again, the Biden administration, of course, made a humongous purchase so that they are able to provide 4 tests to each household. So, those are a number of tests that come out of basically what we're able to order. But we're good with that. I mean, we're happy that people get the tests, however they get them.
Jones?
Just to follow up with Dr. King's comment and suggestion is, we were talking about handing these out at the vaccine clinics and doing our best given the staffing issues and concerns. But my biggest concern and fear would be that someone symptomatic would come to one of those locations. So just making it very clear to the public that please do not show up to these if you are symptomatic to get a test, that these are mostly for people who are coming in asymptomatic.
Excellent point.
Okay. Think you're good,
All right.
Dr. Hughes?
Thank you.
And I don't see, Ben, that's the old hand?
I don't know how to make the hands come down.
No? Okay, all right.
Sorry.
So, thank you. We'll go to item 7. I think we kind of offered that up and nobody had any questions on reports. If we go to the back to board comments, let me note by beginning with item A. I think ideally this would be our first location, but I think to explain to everybody, there's a year-long first preference that's on this, and we happen to be lucky to get it today because a court case got called, so we were able to get this room. But I'll show it to everybody across the street. Dr. Hughes and I, in late December, along with the county's facility manager, Jerry Leahy, went and looked for some space that was kind of more spacious. Just trying to be in good stead. Luckily, we got it ahead of Omicron. The old United Way building across the street is where we're going to have it. There's space on the second floor. The county bought that building, redid it COVID-wise. There's a room there. Their mobile equipment is there to be able to move and roll around. But basically how the meetings have been going now, other than if there's 3 or 4 cameras, most of the staff have been on Zoom, which they'll still be able to be. But the board will have a little more space. We'll be able to set it up in a U format space to some degree. Then there's a whole separate area there. And so that's where we're gonna develop that as the meeting space from now on, because it's a little more area than the tight room there in the health department. And so that'll be where the meetings will be at starting next month. And before we go, you can walk right to the window and I can show you where it's at. Other than that, there was also another conversation that Dr. Hughes had, and it's to build on. And it's one question I do have for you, Dr. Hughes, after I say this, because I want to make sure. But we had talked about kind of next steps of, well, I mean, the main thing I want to make sure is, before I make this statement, just explain to me, at one time, you know, when things were, we were so all hands on deck COVID, then we kind of got out of that mode in the summer. Now, are you finding a happy medium, I guess, just staff-wise, where, okay, COVID's what we're going to have to deal with, but we're still able to make the functions of the health department function?
Yeah, absolutely.
Okay.
You know, it creates even more problems when we're not doing all of those other public health functions that we need to be doing. So I think it makes good sense right now to try to balance those as much as we can.
Okay. Go ahead. And I say that to set up this next piece, that before things really got there, you know, we went through this phase where the board was wanting to go into policy and those things around the social determinants of health. So there was after conversation with Dr. Hughes, I made an outreach to the staff at MAPA, the Marriott Metropolitan Area Planning Agency, to talk about the recently passed transportation bill. And so I just wanted to bring it to the board to make sure everybody was known. There's a conversation we're going to have with them in respects to really trying to be able to read through and look at that bill and build on what the Board of Health wanted to do with the social determinants of health in that transportation space and what's coming out of that bill. MAPA's very eager to work with us there. They have a staff member who's actually spouse to Lauren, who's the ex officio member of our board, and they'll be working with us. He works specifically in transportation to look through the bill to see what opportunities are, and then similar to how before COVID, and we were doing some of the work on housing and trying to pull that out of there, we're going to try to pull opportunities out of the transportation bill where public health emphasis is there and try to lift those up. So if everybody's fine with that, just know we're going to dig into that a little bit of where the opportunities are. Right now, a lot of the federal regs are being there. People are reading through it. And I'm trying to just understand a little bit more MAPA's powers and how that goes. So Dr. Hughes and I talked a little bit about that to try to bring that into the board as far as an update and report on that. And other than that, there's a couple of items that were brought to me by some board members, and Dr. Hughes and I had an initial talk about how to bring back the community health needs assessment reports and reports from the hospitals on community health benefit. That might have to wait a little bit based on this surge. But no, there were the requests that came forth, Dr. Hughes had, and we're working through them to bring them forward. That's all I have, unless anybody else has something else.
Reminded me, prior to COVID hitting, there was discussion around Douglas County having a housing sorry, my apologies. Prior to COVID hitting, there was conversation around the health department having a housing ombudsman, but that kind of got put on the back burner. Has those conversations started? Just because I know that there's, within that housing space locally, there's a lot of work going on, and have those conversations continued, et cetera, with getting that position?
They have not. However, now that our health equity office is fully staffed, I would anticipate that those discussions would move forward. And we agree that housing is just, it's incredibly important as a social determinant, and we need to address that in the community. So I am pretty sure that that's going to be happening going forward.
Okay.
And I think Chris made me think when we were talking about the other functions and stuff, and I haven't seen any stats on influenza. Do you have any information on that this year, or how has that been going with everything?
Yeah, we have flu also is on the increase in the community. I don't have exact numbers for you at the moment, but we did report a death this past week from influenza. I'm not sure if it came out or not, but I think the state was actually going to do a joint release that basically listed out all of the deaths that had happened in the last week or so. There have been several, so it's definitely here. It's definitely complicating things. I know that the death that we had in Douglas County was also co-infected with COVID-19. So you can imagine how awful that illness would be. So it's definitely here, and it's not like last year where we had almost no cases. All right.
Seeing nothing else, we do have need for an executive session for litigation. And so with that, we will need to go into executive session for the purpose of litigation. So is there a motion to do that? Motion by Wyatt, second by Wilkin. Let me note before we vote that ideally people on Zoom will be ending. There's no action we're going to take. So after we come back from executive session, we'll pretty much just adjourn. So that's the meeting. So just note the Zoom will be turned off and you can go. So, and anybody waiting, there'll be no other action after executive session. We'll just be adjourning. So there's a motion a second to go into executive session for litigation. Roll call.
Jones. King. Yes. Rice. Yes. Rogers.
Yes.
Gray. Yes. Wade.
Yes.
Wilkins.
Yes.
All righty. Thank you all.
Wade?
Yes.